For my Integrating New Knowledge video, I have decided to focus on an interaction that I had with a patient during my fundamentals rotation in the fall of 2017. The facility where I was doing my clinical rotation is a long-term care facility located in Chicopee, Massachusetts. During my time there, I worked with a patient who had several different comorbidities and was at the facility after being taken to the hospital for unmanaged type 1 diabetes that led to neuropathy in his hands and legs and retinopathy in both of his eyes. I started the clinical day by going in and introducing myself to the patient and to take a quick set of vital signs. When I walked into the room, I was greeted by the sight of my patient sitting up in a chair by the side of his bed watching television. I introduced myself and I told him that I was there to do vitals and that I would be back sometime later with some questions for school if that was okay with him. The patient looked up to me for a second, said hello, and then nodded and held out his arm. I took his blood pressure and I did my assessment, and then I left the room. When I returned later, I asked what he was doing, and upon getting a positive response, I jumped into my questions. I asked all about his past medical history, about the different medications he was taking, and if he understood why he was taking those medications. I felt that I had provided good care. I had asked how my patient was doing, and I had attended to his needs. I felt that I had acted like a good nurse. Looking back now, I realized that I had left out a large portion of an assessment that a good nurse does. I had never assessed if his psychological needs were being met. The facility had 3 people to a room, but I never asked if he felt like he had his own space. I'd never asked him what he had done to cope with stressful situations in the past, and if he was able to cope in the situation he was in now, having recently been sent to this facility. I never asked him if he had any history that led to him not managing his type 1 diabetes, the event that led to the majority of his other health problems. I never stopped to assess his mental health, something that I know now is a very large part of someone's care. Throughout the semester, we've talked and learned a lot about therapeutic communication and how important it is when interacting with patients in order to assess their mental health. I have seen firsthand through my clinical experience that when therapeutic communication is not used, there's not a good relationship between the patient and the nurse, and the health and care of the patient suffers. During one day of my psychiatric clinical rotation, I saw a nurse communicate with a patient who had a very similar situation to my patient, and I saw how through therapeutic communication, she was able to help the patient realize that the loss of the patient's job had caused her to fall into a depression, during which the patient stopped caring for her other medical conditions and had become very sick. I also learned how therapeutic communication was important through the demonstration done by Professor Chandler and Professor Green in class. In that instance, it was clear that the therapeutic communication helped build the working relationship between Professor Chandler, the nurse, and Professor Green, the patient. After seeing that and reading an article on therapeutic communication for patients with diabetes, I've learned a lot about how therapeutic communication can greatly improve the patient's outcome. If I was to do this interaction again, I would start with introducing myself and then asking the patient how he's doing and how his care has been so far. I would ask him about how the care he had received had impacted him so far and if it had been effective treatment. In the interaction that I had, I told my patient what was going to happen, and while it was in the form of a question, I was not truly asking my patient if he was okay doing any of what I was asking. If I was to redo the interaction, I would ask my patient if he was willing for me to ask him some questions and to make sure that it was an okay time to take vital signs. From there, while I was asking the questions, I would use techniques such as focusing, reflecting, and active listening to figure out with the patient how he was doing and what the desired outcomes from our interactions were. Therapeutic communication techniques helps the patient identify their strengths, helps them build the therapeutic relationship between the nurse and the patient, and help the nurse provide the best care possible. In my practice in the future, I will ensure that I use therapeutic communication with every patient that I work with to create a working relationship so that the patient and I can work together to have the best possible outcome for the patient's physical and mental health.